Hello, I'm Dr. Eva Carmona, the Program Director of the Clinician Investigator track at Mayo Clinic. Thank you so much for your interest in our program. Here at Mayo Clinic, we are fully invested in training the next generation of physician scientists. Our graduates will be well prepared for successful careers in academic medicine and will be the future leaders of medicine and science. In addition to receiving unparalleled medical training, our Clinician Investigator residents are taught by world experts of all areas of science. Mentors are available from any of the many research departments, centers, and institutes at Mayo Clinic. Our program is rooted in the commitment of Mayo Clinic to the advancements of biomedical and translational research. With 40 years of history, the program sets the standards for training prolific physician scientists across all specialties of medicine and surgery. Trainees in the program have contributed to knowledge and discovery across the spectrum of medical and surgical sciences, from basic to clinical research. But I will let our residents and fellows tell you more about our program.
The Clinician Investigator track is a 2-year program of uninterrupted research for doctors both with and without other advanced degrees, which is incorporated into the residency and fellowship training. The main goal of the track is to offer clinicians in training a base from which to launch further mentored research and to foster independent research as a clinician scientist. The program is overseen by the Clinician Investigator Training Program Committee and funded directly by the Mayo Clinic School of Graduate Medical Education. While in the program, you will have unparalleled access to research resources, including internal and external grants, statistical support, manuscript and grant writing workshops, and protected time to present your research at prominent conferences.
The CI program typically funds up to 9 2-year training positions each year, 5 total in internal medicine and medical subspecialties, and 2 each in surgical and surgical specialties and medical and laboratory specialties. Selection for these positions are made by the CI committee. Among internal medicine and medical subspecialties, 3 of the candidates for CI positions may be selected at the completion of medical school through the NRMP match, while the remaining 2 will be selected during the 2nd year of clinical residency training. Regardless of the time of acceptance, you will enjoy 2 years of uninterrupted research time that is conducted under the supervision of a mentor who has agreed to this role. If so desired, the time spent in the CI program may also be counted toward attainment of a master's or PhD degree specific to your areas of research interest.
Let me give you an example of how our program is structured. As a CI candidate accepted into our Hematology-Oncology Fellowship, you will first start with 2.5 years of internal medicine residency training. Afterwards, you will start your 2 years dedicated research time under the supervision of a mentor of your choosing. During the first 6 months of your research, you will continue to have 1/2 a day per week of continuity clinic within internal medicine. This is important as it is required to satisfy all your milestones to be fully internal medicine board eligible at the end of your 3rd year of residency. During the next 18 months of your research, you will continue to have 1/2 day per week of clinic. However, this will be dedicated to seeing patients coming in with hematological or oncological illnesses. This will be particularly valuable in maintaining clinical skills, as well as reinforcing the importance of translational research in our program. In addition, you are required to attend all your hematology-oncology core curriculum lectures.
The cardiovascular disease CI track splits the 2-year research time into 1.5 years between the residency and fellowship, and 6 months during your final year of fellowship. At the end of the program, you would have spent a total of 7 years in training and earned multiple completion certificates, 1 for internal medicine, 1 for the clinical investigator program, 1 for general cardiovascular disease fellowship, and lastly, another advanced research degree, if you choose. Keep in mind that the fellowships differ in their clinical training requirements to obtain board eligibility. For example, while the Hematology-Oncology Fellowship requires 2 clinical years, the Cardiology Fellowship requires 2.5 years, and the Gastroenterology Fellowship requires 1.5 years. This will impact the length of training in the CI program.
Your research during the CI training could be conducted on basic, translational, clinical, and/or epidemiological projects. The research at Mayo Clinic is driven by the patient's needs and advancing their care. Mayo Clinic researchers work in a collaborative approach to develop new and improved diagnostic tests, drugs, devices, and more. Mayo Clinic makes it possible for any CI candidate to unravel and solve complex research questions thanks to its unique culture of collaboration and teamwork, and its extensive research core facilities. These facilities are centralized and provide access to instruments, technologies, testing, and services. They make it possible for us to focus on our own area of interest with the complementary assistance from our cores. As a result, research findings can move quickly from the lab to the clinic.
Research services at Mayo Clinic are unmatched. The biospecimens accessioning and processing core provide us access to expansive biorepositories that include highly curated and annotated biobank specimens. The pathology research core services include immunohistochemistry, tissue microarray construction, digital imaging, and laser microdissection. Our biomolecular analysis service line includes high complexity cores offering top-of-the-line research focused on genome analysis, proteomics, metabolomics, and cytogenetics. Our antibody hybridoma and transgenic and knockout cores are focused on the production of monoclonal and polyclonal antibodies and transgenic and knockout mice. Other services include imaging such as microscopy and cell analysis, structural testing, and data analytics such as bioinformatics, biostatistics, and survey research.
Thank you again for your interest in our Clinician Investigator program. I'm sure that at Mayo Clinic you will find all the support and resources you need to be a successful physician scientist. I'm very excited to meet you and learn more about you and your research interest.